Hello, everyone, and welcome to today's Safety and Health Magazine webcast, Injury and Illness Record Keeping, Just the FAQs, sponsored by J.J. Keller and Associates. My name is Barry Botino, and I'm an Associate Editor with Safety and Health. I'll be your moderator today. Thank you so much for joining us. From our team here at the National Safety Council, which is currently working remotely, we hope that you're all safe and healthy amid the COVID-19 pandemic. In a few minutes, we'll start the presentation, but first I'd like to go over just a couple housekeeping items with you all today. First, the views of today's speakers and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not mean the Council or the magazine endorses those items. To ask a question today, simply type it in the text box in the lower left-hand corner of your screen and click the button for Submit Question. Our speakers today will be answering your question during today's live event and also after the presentation in our Q&A session. So feel free to ask your question at any time at all during the presentation. We'll try to answer as many questions as possible today, but we might not get to every question. Just in case we don't, any questions we don't get to will be forwarded along to our speakers today. If you happen to have any technical issues during this webcast, please refer to our list of helpful tips, and that is located on the right-hand portion of your screen. For basic troubleshooting information, just click that Help button located at the bottom of your screen. And our folks at J.J. Keller and Associates have made the slides available from today's presentation, and you can find those under the Resources widget on the lower left-hand part of your screen. At the end of the webcast, you'll be asked to complete a brief evaluation survey, but I'll tell you about that a little later. Finally, this webcast will be archived, so you can access it after today's live event. To view this webcast and all of our past webcasts, just find us online at safetyandhealthmagazine.com/events. With that, let's introduce our presenters today. Our speakers are Lisa Newberger and Derek Plowden. Lisa is an editor who specializes in workplace safety and environmental topics, focusing mainly on hazardous waste. She's the lead editor for J.J. Keller's Environmental Alert newsletter and the Comprehensive Environmental Compliance Manual. She also contributes to leading trade magazines. Derek serves as a technical editor for J.J. Keller's Content and Consulting Services. He specializes in a wide array of topics, including construction regulations, ergonomics, walking working surfaces, and personal protective equipment. And he also writes for the Haz Safety Training Advisor monthly newsletter. Again, we thank you all for tuning in today for this presentation. And Lisa, whenever you're ready, go ahead and take it away.
Thanks so much, Barry. Thanks, everyone, for joining us. Derek and I are just thrilled to be here today to discuss OSHA's injury and illness record-keeping regulations with you. Record-keeping at Part 1904, it's one of the topics that we get the most questions on every year. And the reason for that is, on the surface, record-keeping seems pretty straightforward. OSHA tells you that if a case is work-related, if it's new, and if it meets one or more of the general recording criteria, it's recordable. But we all know putting that into practice can be a lot more complicated. And that's because you have to look at each case separately. What's recordable in one situation may not be in another. And maybe only one factor was different in those cases. Now, today, the topics we'll cover will start with who has to keep the Part 1904 records. We'll move into the general topic of what makes a case recordable. Then we'll get into the specifics of work-relatedness, new cases, and the general recording criteria. Now, during this webcast, we're going to test your knowledge, and we'll go through several FAQs. As we get to each question, keep in mind, Derek and I didn't make these up. We chose real FAQs from OSHA. So these are real questions people have asked OSHA over the years, and of course we'll include the agency's answers. Now today this is going to be a general record-keeping discussion. So we're not going to cover COVID-19, but feel free to ask COVID-19 related questions or really any record-keeping questions that you have today. Please submit those in the Q&A box. And Derek and I will answer as many of those as we can as we go along today. Now, before we really jump into the questions, just a couple basic record-keeping items to cover. So, you're covered by the routine requirements to keep the OSHA 300 log, the 301 incident reports, and the 300-day summary if your company has 11 or more employees at any time throughout the year. Now that's for your entire company. So if your entire company had 10 or fewer employees at all times during the last calendar year, then you're not covered by the routine record-keeping requirements. Individual establishments may be exempt from the routine record-keeping requirements if they're listed as low-hazard industries. And you can look that up and see if you're listed as a low-hazard industry in Appendix A to Subpart B in Part 1904. Beyond that, even employers who don't normally have to keep the records must keep them for a year or two if they're selected by the Bureau of Labor Statistics, or the BLS, for the survey of injuries or illnesses. So it really doesn't ever hurt you to understand record keeping, even if you're normally not required to keep the records. And then for all employers, even employers who don't keep records, you have to report to OSHA any work-related deaths or severe injuries, and those are your inpatient hospitalizations, amputations, or loss of an eye. And you have to report those to OSHA within the time frames in the regulations. Now you need to keep your injury and illness records, your logs, your summaries, your incident reports, any privacy case logs, any documentation around your record keeping for 5 years following the end of the calendar year that these records cover. During the storage period, you must update your stored OSHA 300 logs to include newly discovered recordable injuries or illnesses, and to show any changes that have occurred in the classification of previously recorded injuries and illnesses. If the description or outcome of a case changes, then you have to remove or line out that original entry and enter the new information. Now, the good news is you don't have to update your summaries during that 5-year update time. Okay, so that's the basic stuff. Let's jump right in. What I'd like you to do right now is make sure that you have a red group chat icon, and we're going to use that today to share responses for our fun FAQs that we're going to go through. So we'd like you to use the Q&A box for those FAQ questions, and then for your actual questions that you have on record keeping, please send those through the Q&A box. Okay, so let's start with our first FAQ. So what do you think about this one? You have a workers' comp insurance carrier who has denied a workers' comp claim. The workers' comp carrier said the case wasn't work-related. So if that's the case, do you still have to record? This is a kind of question that comes up all the time. A common scenario in this kind of thing. We'll have a worker walking across a level floor. She trips over her own feet and she's injured. Now, workers' comp often denies this kind of injury, saying it's not work-related. So what do you think? You have a few choices here. So would you not record because workers' comp said the case is not work-related? Would you record because it doesn't matter what the workers' comp carrier says? Or would you examine the case? And if it meets OSHA's criteria for recording, then you'd have to record, even if the workers' comp carrier denied it. So go ahead and use your group chat, and we'll see what everyone has to say about that.
Seems like a lot of folks here are saying yes, Lisa.
Okay, great. I'm having trouble actually viewing the chat, so Derek, maybe if you could jump in and kind of let me know what people are saying.
Oh, of course. So we've got a lot of folks saying yes, a lot of say examine.
Okay.
A lot even saying do not record.
Okay, how many? We have a lot of people saying do not record?
Yeah.
Okay. Well, so in this case, we would have to examine the case for what OSHA says. We have to go with OSHA's definition over workers' comp, which can get kind of confusing because, you know, in a lot of cases, what workers' comp definition is not going to be the same as what OSHA's is. And so you have to remember that they're entirely separate animals, and you can't rely on what workers' comp says. And that gets to be difficult because a lot of times the same person who's doing the workers' comp is the person who's doing the OSHA recording. So I always like to bring this out right in the beginning. They're two different systems, and you want to make sure that when you're doing record keeping, you are relying on OSHA's definitions and OSHA's system. So thanks for filling that out, everybody. All right, let's go on to the next slide. So as we get to more FAQs, I want you to keep in mind that for a case to be recordable, that is for you to record it on your 300 log, it has to meet all the conditions here on this slide. So the injury has to be work-related according to OSHA's definition. And OSHA's definition of work-relatedness is found in 1904.5. It has to be a new injury. Again, according to what OSHA says is new. And it has to meet one or more of the general recording criteria. So those are death, days away from work, restricted work activity or job transfer, medical treatment beyond first aid, and loss of consciousness. OSHA also has sections in the record-keeping regulations for specific cases. Those are things like hearing loss, tuberculosis, needle sticks and sharps, and medical removals. Now, we're not going to go into those today because we would be here all day long. But if you're interested in learning more about them, let us know, and we'll get you more information about that. So OSHA has a record-keeping decision tree for determining if cases are recordable. And this is actually found in the regulations at 1904.4. Now, you can see that it walks you through the conditions we talked about in the last slide. Start at the top with the most relevant question, and that is, did the employee experience an injury or illness at all? So none of the rest applies if you don't have an injury. So if you just have a sore muscle case, or if you have an exposure but no symptoms, you don't have an injury or illness to record, at least not yet. Next, you go through the steps to determine if the case is work-related, if it's new, and if it meets one or more of those general recording criteria. So again, you can find this decision tree in the regulations in 1904.4, or you can walk through the steps using our record-keeping tools that we have on our safety management suite. So now I'm going to turn things over to Derek, and he's going to walk us through more on work-relatedness.
All right, awesome. Thanks, Lisa. So when determining work-relatedness, it's safe to assume the case is work-related if it happened in the work environment, unless one of 9 very specific exceptions applies. And we'll look at those exceptions. But first, you want to note that all the conditions listed in the exception have to be met or the case is work-related. Now, we'll look at a few of OSHA's FAQs that show you how this works, but first we want to take a look at those 9 exceptions to work-relatedness. So here are the first 3 exceptions to work-relatedness. Now, you can see that in each of these exceptions, there are conditions that must be met. And what are those conditions, right? The first exception is that the employee has to be there as a member of the general public. For the second exception to work, the injury or illness involves a sign, symptoms that show up at work, but have nothing to do with the workplace. And of course, for the third exception to apply, the injury or illness has to be related to a voluntary activity. So things like playing basketball, football, something to that effect. Now here are the next 3 exceptions to work-relatedness. The fourth is very specific to eating, drinking, or preparing food for personal consumption. Number 5 is for personal tasks that have nothing to do with the employee's work, and it has to be outside of the employee's assigned working hours. And this one often throws a lot of employers off. They think that if an employee is doing a personal task during a break in the workday, that this exception applies. But OSHA says breaks are part of the employee's assigned working hours. Now that word solely appears again in number 6 here. Work cannot play a role in the injury or illness. For instance, if the employee takes a shower after work to get ready for a date, well, that wouldn't be work-related. But if the employee was required to shower to remove a workplace contaminant like a chemical, that would be work-related. And here you can see the last three. Number 7, you have to meet all 3 conditions for the exceptions to apply. Remember that parking lots are considered to be part of the work environment, and injury and illnesses that occur there must be examined for recordability. So this exception applies if 1, the incident involves a motor vehicle, 2, it happens in the company-owned parking lot or access road, and 3, it happens while the employee is commuting to or from work. Number 8 only applies to the common cold or flu. Other communicable diseases could be recordable if they meet the recording criteria. COVID is another one that's on there. Now, OSHA says that COVID can be recordable, again, if it's work-related, if it's confirmed by a lab test like the CDC, and it results in days away from work, death, or medical treatment beyond first aid. And also to note on that one, for some of you who are still confused about the COVID-19 ruling, there's also a memo out there that helps with making that determination of work-relatedness. The agency expects you to make some sort of reasonable means to investigate those cases of COVID-19 in your workplace. They suggest that you ask the employee how they believe they contracted the COVID-19 illness. While respecting employee privacy, you want to discuss the employee, his work and out-of-work activities that may have led to the COVID-19 illness, and then review the employee's work environment for potential SARS or COVID-19 exposure. In the review, consider any other instances of workers in that environment contracting COVID-19 illness. Moving on to number 9, unless the employee tells you about their condition and has been diagnosed by a medical professional who is qualified to make the diagnosis, a psychiatrist, a psychologist, or a psychiatric nurse. All right, so let's move on with our FAQs. What do you think here? Is this one work-related? An employee falls in the restroom at work. Someone had left baby powder all over the floor. And we're just looking at work-relatedness here. Now you can select from no, the restroom is not the work environment, or yes, it occurred in the work environment. What do you guys think? Okay, so I see a lot of yeses coming in, some no's. Wow, a whole lot of yeses. Let's see what we got here. So yes, did occur in the work environment. Right? If you chose yes, the room is part of the work environment. Again, you're right. Remember that OSHA says if the employee is present as a condition of work, which would include anywhere on your premises or even when the employee is off-site or traveling for the purpose of doing something in the interest of the employer, that's going to be considered work-related unless one of those very specific exceptions applies. To those of you that chose yes, awesome job. To those of you who didn't, make sure you just go back and check those exceptions again and read through those just to get some clarifications answered up. Lisa, I'm going to move this on to you.
All right, thanks so much, Derek. Okay, so we have another FAQ coming up. So in this case, we have a company hosting a family fun day. Attendance is voluntary. So if an employee gets injured and requires medical treatment, is that an OSHA recordable for you? This kind of thing comes up all the time. You want to do something fun for your employees, but you kind of have to worry, is someone going to be hurt? And if they are, do you have to record it? So in this case, you get to choose yes or no. I'm going to have Derek. Can you help me out here again? I'm having a little trouble seeing the group chat.
Of course.
So
no problem at all. Yeah, no, this is another good one, Lisa. This is another good one because remember, when you're thinking about this one, consider the exceptions that I talked about early on, right? Those exceptions are well known, as Lisa knows, for making or breaking the recordability of a case.
Right.
And we have a lot of folks saying no, some saying yes. Go ahead, Lisa.
Okay. Why don't we go on to the answer? Okay, and those of you who selected no are correct. That exception at 1904.5 in paragraph B2II applies. So this is a voluntary participation in a recreational activity. Now, if you expect your employees to attend, if you require them to attend the event and an employee is injured, that's different. because that's not solely the result of voluntary participation. And then you would need to evaluate the injury, because in that case, it would be work-related. Okay, now I'm going to turn it back over to Derek for another one.
So what do you think about this one? We have an employee who was injured in the company parking lot, either before clocking in for the day or after clocking out for the day. What do you think, yes or no? Of course, I see some answers pouring in. Some say no. Some are saying yes. Lisa, anything you want to add to this one?
This one is a tricky one, and one that will be coming up for those of us located in areas that get slippery conditions, unfortunately, very soon. So I'm looking forward to seeing what people have to say about this.
A lot of yeses in here, Lisa, and you're right. The parking lots are considered part of the employer's establishment. Punching in or out of a time clock does not determine the outcome here for work-relatedness. And why is that? Well, that's because none of the work-related exceptions under 1904.5b2 apply to the event. The case is work-related. Now, should note, company-owned parking lots and access roads are considered to be part of your establishment. So injuries and illnesses that occur there are considered to be work-related unless one of those exceptions applies. Now, there is an exception, keep in mind, for motor vehicle accidents that occur in the parking lot while the employee is commuting to or from work. But again, that one's a very specific exception. The injury has to involve a motor vehicle, and it has to be during the commute. In addition, OSHA says that clocking in or out, taking breaks, lunch hours, none of those things matter on their own when determining work-relatedness. The employee would have been there or would not have been injured, except that they were acting in the interest of the employer or there because of the conditions of work. Lisa?
Great, thanks, Derek. Okay, so this next one, I want you to remember, Derek and I didn't make these up. These are actual OSHA questions. So don't get mad at the messenger on this one. So on this one, we're going to look at more closely at what OSHA considers to be personal tasks for the exception at 1904.5, paragraph B2.5. Now, this OSHA FAQ asks about a woman who was knitting a sweater for her daughter during a lunch break. If she hurts herself with a knitting needle and she needs stitches, is this case going to be work-related and recordable? Now, this FAQ is asking about whether the exception for personal tasks is going to apply. What do you think? Again, please use that group chat feature. And Derek, what kind of things are we seeing?
We're seeing a lot of no's here, Lisa, on this one. Some yeses, but mostly no's.
Okay. So when you're thinking about why you're choosing no, you're probably choosing it because it's a personal task, right? But for that exception to apply, you have to meet both of the conditions in the exception. And both of those conditions are, yes, it's a personal task, but it's also outside of normal work hours. And what OSHA says normal work hours are may not be what you and I would think of normal work hours. So it could be, the time that an employee has right before work when they're leaving their car and coming into the work environment, or leaving for work after they've clocked out for the day, or leaving for home after they clocked out for the day. It can be break time, and it can also be that lunch hour if they're in the work environment during their lunch hour, which is what happened in this case. So unfortunately, this case is going to be work-related and recordable. And again, don't get mad at me on this one. This is what OSHA says. So I always consider this one really a great example of when that exception applies for personal tasks. Other things to think about for personal tasks are, is it a personal task? or is it related to work? So even if you have an employee who stays late after work, if they're doing something work-related, say they're staying to work on a report or they're getting a test ready for the next day, that's going to be work-related for you because it's related to work. But if you have an employee who's staying late to work on a child science project, or one we always like to use is, are they building a go-kart for the after-school club? That's going to be for the exception. The exception is going to apply in those cases because they stayed late, so it's not during work hours, and it's not work-related. Okay, let's go on to the next slide then, Derek.
So how would a company report an injury that was a result of an employee's diabetes? The employee felt weak, started to faint, fell and broke their ankle. So what do you think? Is this recordable? Again, we have an employee who fell, faint, falls and breaks their ankle. There's a possible loss of consciousness and a broken bone here. And remember, when you're thinking about this one, you want to think about those exceptions we talked about earlier. And I'll give you a little hint, pre-existing conditions. Let's see, we've got a lot of yeses. Some here are saying it's recordable, yes. Well, a lot of answers flooding in here at the same time, Lisa.
Excellent.
Some no's. All right. Let's talk about the answer here. Right? So if an employee's pre-existing medical condition is the sole cause of the incident which results in a subsequent injury, this is not a work-related injury and it's not recordable. However, if the work environment or work activities of the employee contributed to the employee's faintness, this would be a recordable injury. Now, OSHA says that if the injury involves signs or symptoms that surface at work, but solely result from non-work related events or exposures that happen outside of the work environment, the case qualifies for an exception to work relatedness. So in this case, it involves the employees with diabetes. The employee would have felt faint and fallen regardless of the work environment. But what about if the employee was working in a hot work environment and the heat contributed to the employee fainting? Well, that would be completely different, right? That means that the diabetes was not the sole reason for the employee fainting, but that events or exposures in the work environment caused or contributed to the resulting injury. Then the case would be work-related.
Okay, let's move on to new cases. So far, we've really been talking about work-relatedness and kind of going through all of those exceptions to work-relatedness, what makes the case work-related, what doesn't. And that tends to be the most difficult determinations that you have to make with record keeping. But there are two other legs of the triangle that make a case recordable. So we've got the first leg is work-relatedness. The second leg here is new cases. So what does new mean according to OSHA at 1904.6? You can see on your screen, a new case means that the employee hasn't had that kind of injury or illness before, or the employee had that kind of injury or illness before, but had fully recovered from it. So that means that all the signs and symptoms have disappeared. Now, that's usually pretty easy to determine, but not always. So things like muscle strains, back injuries, those can be tough to tell if the employee is completely recovered. And in those kind of cases, you can certainly check with your employee's doctor if you'd like to make that new case determination. Now, if you do consult a doctor, OSHA says you have to go with that opinion. So if the doctor tells you it's a new case, you must record it as a new case. Now, why is it important to know if you have a new case, besides knowing that's the second leg of the determining if you have a recordable case or not? OSHA tells you you need to update your log for a period of 5 years. If you have an old case during that 5 years, if you have a case that's changed, you have to update. If you have a new case, well, then you have a new entry to your log. So that's where that kind of comes into play. And it can affect your injury and illness rates, knowing whether or not you have a new case or if you have an old case. Okay, so let's go on and look at some FAQs for new cases. So here's an FAQ. This kind of thing does happen in the workplace all the time. So you have an employee who hurt his back on the job, and that was in March. Then in September, he hurts his back again, and he requires more days away from work to recover. So how are you going to record this? Do you record this as a new case, or do you update the log for the original entry, or is there another choice? Okay, so good news, Derek. I am able to access the group chat, and I am seeing lots of it depends. People saying, depends, did he recover fully in March? Yep, lots of people saying depends. So someone saying if it was aggravated. So new if fully recovered. Must investigate to see if the case is resolved. Update for the original entry. It depends. Okay, so I think we're getting the sense of everybody saying it depends. So Derek, let's go ahead and see what the answer is. And the answer is it depends. So good job, everybody. It does depend on whether the employee had fully recovered from the injury in March. This is probably one you'd want to consult the doctor on because with back injuries, it's really hard to tell if the employee has fully recovered or not. OSHA does say that you don't have to go to the doctor. You can use your best judgment. And some ways to know whether the employee has fully recovered or not are, how much time has passed. There is a lot of time between March and September, but for back injuries, we all know that sometimes takes a little bit longer. Also, for the appearance of the body part, do we have bruising? Is there swelling? If those things are still in place, you probably have, the original injury has not fully recovered. OSHA also says signs and symptoms of a previous injury that disappear for only a day and they appear the next day. That's good evidence to you that the injury hasn't completely healed. Okay, Derek, I'm going to turn it back to you.
Yeah, sure. And really good points, Lisa. Sometimes cases like these can be pretty tricky. All the cases that we're going through now, so much in fact that some employers might feel a little bit, a little pressure to get it right? But like Lisa said, if you aren't entirely sure, use your best judgment. And I guess I'd say to add to that, you can even document your reasoning behind your decision and provide that to OSHA should they have questions. Having that documentation on file can be extremely useful.
That's a really great point, Derek. I'm glad you brought that up because OSHA is not really necessarily looking to make sure that you're getting everything exactly right. They're looking to make sure that you are going through the steps correctly and that you are using your good faith. You're making a good faith effort to record correctly.
So with that, we will move on. Next FAQ. Here's an interesting situation. How would you record a case where an employee is working on restrictions from one injury and then gets another injury? Is that a new case? And this is based on an FAQ, again, that asks an employee, has a work-related shoulder injury resulting in days of restricted work activity. While working on restricted duty, the employee sustained a foot injury, which resulted in a different work restriction. How would the employer record these cases? So again, would you count both injuries on the log? Would you combine the injuries? Or would you stop the count for the first injury and only count the second? What are we seeing with this one, Lisa?
I'm seeing a lot of people saying that it should be a new case. That is some people saying both. So it's kind of 50-50 between both, and some people are saying stop the count. And I should point out that this is not just an FAQ, this is actually in the regulations. So OSHA tells you how to do this in the regulations in 1904.7. So why don't we move on and see what the answer is.
So, you would enter a new case and begin counting the calendar days for that case. Now you can stop the count on the first case. Again, do not double count the days on both cases. The second injury is a new injury, so in this instance, you stop the day count for the first injury and start counting the days of the restriction for the second injury. If the restrictions for the second injury are lifted before the first injury, well, then you would resume the day count for the first injury.
So that one's a little bit complicated, but it's good news for you that you are not having to double count those days if you have two injuries that are going on at the same time.
Awesome. So the third condition that has to be met for a case to be recordable is one or more of the general recording criteria listed in 1904.7. The general record-keeping criteria are listed on this slide. They're listed in order of seriousness. Obviously, death is a worst-case outcome, followed by days away from work, and then the rest of the criteria. Now, when you have a case that involves more than one of the items on the list, say a case that involves days away from work and days of restricted work activity, you only check the box on the log for the most serious outcome, which would be days away from work. However, you count both the days away from work and the days of restricted work activity.
Thanks, Derek. Good points. Now, as we've mentioned throughout this webcast, accurate record keeping can ensure that you're not recording more injuries and illnesses than you need to. And that can skew your incident rates and could lead to an OSHA inspection. While you can't prevent OSHA from paying a visit, you can be well prepared. And this means having a complete training program, having well-written safety plans, and maintaining a comprehensive hazard communication program. J.J. Keller's newest EHS solution is the Safety Management Suite, and it has the resources and tools to help you easily manage OSHA reporting requirements, and it will help you develop and maintain your safety program. And since J.J. Keller's Safety Management Suite is our event sponsor, we're offering all attendees a complimentary trial to this innovative management tool. Please use the poll on your screen to select your interests. And along with beta access, we'll also send you a free PDF of our white paper on injury and illness record keeping. And this white paper summarizes general injury and illness record keeping requirements under Part 1904. All right. Derek, why don't we move on to counting days away?
Sure thing. So before we look at more FAQs, let's quickly go over a few important notes about the general recording criteria. In order to correctly count days away or restricted work, you need to know that you count calendar days. That's all the days from the day after the injury until the employee is released to his or her full work duties. Calendar days can include any scheduled vacations, weekends, and holidays. And you can cap the day count at 180 days. And that's a combination of the days away, restricted days, and job transfers. Now, let's look at some FAQs on the general recording criteria. Now, here's the first half of OSHA's comprehensive list of first aid requirements. Anything that is not on this list or on the remainder of the list on the next slide is considered to be medical treatment for record-keeping purposes. Now, this list is pretty straightforward, although questions sometimes come up as well, and we'll see some of those questions in a few FAQs later on today. Here's the second half of that list. If you have questions on any of these first aid treatments, please be sure to send them in. Again, making sure to use that Q&A box. Now, this is one FAQ that we get all the time. How do you record if the doctor places the employee on restrictions and you have restricted work for the employee, but the employee decides to stay home? Would you record that as restricted work activity or record that as days away from work? And Lisa, what are we seeing in that group chat?
All right, everybody. Remember, you can use that group chat. Okay, I'm seeing some restricted work / days away, restricted. So I'm seeing mostly restricted coming in. A couple days away, but mostly restricted. I'd say 9 out of 10 people saying restricted. So why don't we go ahead and see what OSHA says.
So OSHA says record as restricted work. In this situation, you must record the case as a case involving restricted work activity and enter the count of days recommended by the physician or other licensed healthcare professional. Now, OSHA says it doesn't matter what the employee decides to do, but rather what the doctor recommends or the employer decides. But what about if the doctor recommended restrictions, but you don't have any restricted work available? Is that different? We get this question a lot. And yes, it is. In that case, you have to record as days away from work. The difference is that the employer is in control here and not the employee.
Yep, and I saw someone in the group chat said that it's really the doctor's note that trumps what the employee says, and so that's right. But then after the doctor's note, then it goes with, if you don't have restricted work available, then you have to count that as days away from work. So, yep, go with the doctor first, and then go with what you have available.
Thanks, Lisa.
Thank you.
Let's move on to our next FAQ. What do you think about this one? The doctor writes a prescription, but the employee never fills it. In that case, do you still have a recordable? What do you think? Yes or no?
This is another one that comes up all the time. Questions about prescriptions all the time. Even what if a doctor recommends a prescription for a prescription strength medication, but it's only over-the-counter strength? I'm saying that very clunkily. What if the doctor recommends the employee take an over-the-counter medication at prescription strength? That's another question that we get that comes in all the time. I'm seeing lots of people saying, yes, you still need to record it. Some people saying it doesn't matter what the employee does. So let's see.
So OSHA here in this case says yes. OSHA says that all prescriptions, whether just recommended, filled, not filled, for preventative purposes or whatever, are medical treatment beyond first aid. And this even includes a recommendation to take an over-the-counter medication at prescription strength. Now, finding the prescription strength of an over-the-counter drug isn't always as easy as you'd think it should be. If you can't find it using a Google search, you can call a pharmacist or the employee's doctor. Lisa, I'll let you take over the next one. Again, just keep in mind that as we have these questions for you, we are not making these ones up. These are ones that Lisa and I answer, ones that OSHA has gotten a lot of in the past.
Exactly. Thanks for that caveat, Derek. Okay, so here is another FAQ. This kind of thing comes up so much more than you think it would. Not just bees, but we hear a lot about dog bites. I had a question about a bear in the workplace a couple weeks ago. So these kind of things do occur. All right, so we have a question here. We have a worker who's stung by a bee and goes to the doctor because of swelling. Is that an OSHA recordable at that point? So you can select from yes, no, or not yet. All right, I'm seeing a couple not yet, quite a few yeses. So a couple no's, couple depends. Okay, so as you can see, we've got kind of a track record going with our answers on these. Derek, why don't we go ahead and find out what OSHA says? And in this case, it's not yet. It very well could become recordable and probably will be recordable at some point, because if you've got someone who's, swelling enough they have to go to the doctor, they're probably going to need some sort of prescription to treat that, some sort of epinephrine injection or something like that, or a prescription cream for the pain. So if they are getting medical treatment, that's going to be that third leg. But just going to see the doctor, that is not considered medical treatment. So at this point, you have not met all three legs of the triangle. You've met work-relatedness, and you have a new case, but you have not met medical treatment yet. I'm guessing you will need medical treatment on this. Okay, let's move on to the next slide.
So would an incident be recordable if an employee was under the influence of drugs? And this is a very common question people ask OSHA, and it's one that we answer all the time too. So what do you think? Is a case where an employee is injured but was under the influence of an illegal drug going to be work-related and possibly recordable for you? After all, you probably have a policy in place prohibiting the use of drugs or being under the influence in your workplace.
Okay, I'm seeing 90% of the answers coming through saying yes, that it's going to be recordable even if the employee was under the influence of illegal drugs. A couple people saying, it depends on what happens too. Does it meet all of the recording criteria? So that's correct. That you'd have to make sure that it did too. Okay, let's see what OSHA says.
So a case is recordable if the injury requires one or more of the following, which include medical treatment beyond first aid. An example would be a prescription medication, restricted work, job transfer, or days away from work. But what if you terminate the employee for testing positive for illegal drugs after the incident? Well, OSHA says that the determination was related to the injury. So you would need to record any injuries that meet the recording criteria. Now, if the doctor recommended days away from work or restricted work, well, then you would need to count days the doctor recommended or estimate the days away or restrictions and count those in your log. Now, OSHA allows you to stop the day count for injuries and illnesses if the employee leaves your company for a reason that is not related to the injury, for example, to take another job or to retire.
Okay, so before we move on to your questions, and we'll get to them in just a second, let's expand on the requirement to report to OSHA any work-related fatalities, inpatient hospitalizations, amputations, or the loss of an eye. So you need to report work-related fatalities within 8 hours of the incident or of you learning about it, and then you have 24 hours to report the inpatient hospitalization, amputation, or loss of an eye. If you choose to call, you must speak to someone. You can't leave a message, or you can use OSHA's online form. Note that OSHA is following up on every report they receive. Now, some states have more stringent reporting requirements. They may have shorter reporting times for you, or they may have fewer exceptions that are listed in 1904.39. So especially if you're located in California, Minnesota, Washington State, you're going to want to know those reporting times for your state. All right, so now it's time to move on to your questions. As we do that, I just want you to note this slide lists where you can find more information on record keeping, at least in the regulations. You can always send us a question through the Expert Help tool in the Safety Management Suite. Maintaining and analyzing injury and illness records helps you uncover your workplace safety and health issues and track your progress in resolving them. So, good things to note about record keeping. And then with the J.J. Keller Safety Management Suite, you can evaluate injuries, illnesses, near misses, property damage, equipment failure, safety observations, and a lot more. You can auto-generate regulatory documents, such as your OSHA Forms 300, 300A, 301, and develop thorough reports based on your location and your company hierarchy. So if you missed the opportunity, or if you joined us late, we're offering all attendees a no-cost trial to the new J.J. Keller Safety Management Suite. Please use the poll on your screen to select your interest, and then we'll also email you a copy of our white paper on injury and illness record keeping. And with that, we can get to your questions. This is always a fun part of the webcast.
Great. Thank you, Lisa and Derek. We appreciate you sharing all your knowledge and all these awesome examples with our audience today. A reminder real quickly to our audience, if you'd like to ask a question, simply type it in the text box in the lower left-hand corner of your screen and click that button for Submit Question. Our evaluation survey should be appearing on the screen momentarily, and your feedback is really important to us because it does help us to improve our future webcasts. If you don't see the survey on your screen, go ahead and turn off your pop-up blocker. And you may also access the evaluation by clicking the survey button near the lower right portion of your screen. And as you guys can imagine, Lisa and Derek, a ton of questions coming in, some really great ones. I'd like to start with this one. If workers' comp rules the case is not work-related, would that automatically rule out OSHA recordability?
Great question.
That's a good one. Go ahead, Lisa.
Oh, okay. So OSHA says no, it does not automatically rule out recordability. You have to look at what OSHA's definitions are for work-relatedness, and then is it a new case and does it meet one or more of the general recording criteria? If it does, it's going to be work-related, even if workers' comp says that it's not, and that does happen quite a bit.
Great, thank you, Lisa. One more question we have from Rebecca in our audience is, if you have an injury that spans over 2 years, do you record it in both years?
That's a great question. I'm sorry, Gary, go ahead.
No, go ahead. That's one that we get often as well. So, the example here is if an injury that occurred in 1 year, transfers over to the other year and there's still days away that are counting in the next year, you would only record for the year that the injury happened in. So if an injury happened in 2019 and you still have days away in 2020, then you would count the injury as the 2019 injury, and you will only record it once. Lisa, I don't know if there's anything you want to add to that.
Sure. So when you're in 2020, then in that case you were just describing, Derek, if the employee is still on days away from work or still has restricted work when you go to fill out your summary, in that case you're going to estimate the days away you think the employee is going to need in 2019 and in 2020. You're going to count all those together. And you mark those days on your log. Remember, there's a 180-day cap for both days away from work and restricted work, the combination of those two things. And so you mark that on your summary, and then when you actually know the day count, then you'd go back and update your log for 2019. So that comes up a lot this time of year.
Great, thank you for that. And Derek, you mentioned about parking lots, and we had a couple interesting scenarios come up from our listeners today. John asks specifically about a sidewalk from a bus stop to a place of employment, and Josh asks about if a parking lot is not part of an employer's establishment, such as an adjacent parking garage.
That's a tricky one that escapes me, Lisa.
Yeah, so OSHA says that if it is not a company-owned parking lot, so say you've got a shared parking lot, it happens a lot in retail establishments like in a mall or something, you are not responsible. That is, you do not have to record injuries or illnesses that occur there. That would be the same for the sidewalk. If you don't own that sidewalk, if that's not part of your premises, you would not have to record. Now, it's different if that is your sidewalk and you are responsible for it and you're the one who's supposed to be shoveling it and making sure it's, level and everything. So it's all the employer control in the case of those kind of areas. Same would be like in an entryway to a building. If you have a shared entryway, again, a lot of retail stores are like that. You are not responsible for that shared area. It's only those areas you control.
Great, thank you. And as you can imagine, guys, we got a couple questions regarding COVID. Cal asks, how does COVID relate relative to so many employees working remotely in days like these?
Great question. So let's start with what makes a COVID case recordable. OSHA says that to be recordable, a case of COVID has to be work-related, which can be a little difficult to determine. Please check the OSHA May 19th memo, where OSHA goes through how to make that work-relatedness determination. Then it has to be a new case, of course, and it also has to be confirmed by, say, a laboratory test or other means that CDC says. And then it has to meet one or more of those general recording criteria. So that's what makes a case of COVID-19 recordable.
Okay.
Did I answer the question on that, or did I miss part of it?
No, you hit it right on the button, Lisa. Along those same lines, Scott asked an interesting question from our audience about COVID, and he asks, should workplace transmission cases be treated like privacy cases when it comes to COVID?
Ooh, great question, and the answer is yes. Because it's an illness and their privacy does come into it, so you're going to want to treat it as a privacy case. So that was a great question. Okay,
and a few questions have come in about food, and a couple I'll give you here. One asked about what if the employer provides the food, and number two is, does that include if someone has an injury while choking on food that they have prepared?
Derek, you want to handle that?
You can go ahead, Lisa.
Oh, okay. So yes, in both of those cases, the exception for eating, drinking, or preparing food applies, even if the employer brought it in. The only time that wouldn't apply is if everybody gets sick from food poisoning that the employer brought in. In that case, then the exception does not apply. But even if you buy food from the employer's vending machine or from the cafeteria, that exception does apply. Or if you're choking on food that you have prepared and brought in, the exception applies. That's a great question.
Okay, sure. And Sam would like to know, when it comes to record keeping, are city and county governments still exempt?
Ooh, great question. And it depends on your state. So a lot of times in state plan states, they are going to cover public employees. So you need to know what state you're in. In Wisconsin, where I'm located, the employees are not covered by OSHA. So then in that case, you would not be keeping the records, although many employers in public institutions choose to do that.
Okay. Back to COVID for a moment here. We have time for one more question here. And Amy asks, if you live in an area with community widespread COVID, would you record a case as work-related if the healthcare worker reports no breaches in PPE with patients or coworkers, as it is not unlikely that they were exposed in the community?
Something that's coming up all the time, right? Yeah, OSHA says you're going to examine the case to see if it is more likely than not that the employee picked it up in the workplace. Ways you can do that, you can talk to the employee. You can ask them, how do you think you picked this up? Were you at a wedding recently and everybody there got sick? Look at what your employee is doing and who they're exposed to in the workplace. Do you have an employee who, is a cashier and is dealing with the public a lot? That might lead you to think that their exposure was in the workplace. If you have someone like me who's working at home in my little office with my dog, chances are I am not going to have a work-related exposure. So you need to look really closely at what the employee is doing, and then, like this questioner said, is there a lot of community spread going on? So it sounds like in this case, this questioner probably does not have a work-related case. And as Derek had pointed out earlier, just really document these things. Make sure that you're explaining why you're making your decisions, just so you can show to an inspector, say you have employee complaints coming up. You can show you're making a good faith effort to make these determinations correctly. And again, I'd point you to that May 19th memo where OSHA walks you through those steps of making that work-relatedness determination.
Great. Well, thank you both. Some terrific information today. Unfortunately, we've run out of time. Sorry we didn't get to everyone's questions today, but as I mentioned, all of today's unanswered questions will be forwarded along to Lisa and to Derek. Once again, we hope you take the time to fill out our evaluation survey to share your input. And on behalf of everyone here at the National Safety Council, we hope you're all staying safe and healthy. That ends today's Safety and Health Magazine webcast. I'd like to thank our outstanding presenters today, Lisa Newberger and Derek Plowden, everyone from our sponsor at J.J. Keller and Associates, and all of you who listened in today. Have a safe day, everyone.